Hello guys and welcome back. In this video we are going to talk about aortic stenosis. Thank you for watching. Don't forget to like this video and to subscribe to my channel. So let's start. What is aortic stenosis? Aortic stenosis, or AS, is a narrowing of the aortic valve opening, with a prevalence of up to 5% in individuals over 75 years of age. Aortic stenosis is in general a progressive disease and ranges from mild to severe. Aortic stenosis is the most common valve disease in need of surgical or percutaneous intervention. But let's talk a little bit about the aortic valve anatomy. The aortic valve is one of four valves of the heart, along with the mitral, tricuspid, and pulmonary valves. The aortic valve usually consists of three cusps, suspended within the aortic root, which together form a gate between the left ventricular outflow tract and the aorta. The cusps of the aortic valve are concave when viewed from a superior perspective and are not supported by tendinous tissue. Each cusp is usually associated with a specific sinus of the aorta. The left coronary cusp and right coronary cusp are associated with the left and right coronary sinuses respectively, which are the usual point of origin of the left and right coronary arteries. The third, or non-coronary cusp, is associated with a sinus from which no arteries arise. In that case, what is a bicuspid aortic valve? A bicuspid aortic valve is a common congenital heart defect in which the aortic valve contains two cusps instead of the usual three. Bicuspid aortic valve has a prevalence of between 0.5 and 1%. Identification of bicuspid aortic valve is important as they are responsible for more advanced valve dysfunction and are associated with aortic dilatation. The appearance and function of the valve at diagnosis are useful tools to inform discussions with the patient regarding prognosis and decisions concerning the frequency of follow-up. All patients with bicuspid aortic valve should be offered echocardiographic surveillance, and echocardiography screening should be offered to first-degree relatives of patients with bicuspid aortic valve. Now let's talk about unicuspid and quadricuspid aortic valves. Less common anatomical variants are also recognized, which include quadricuspid aortic valve or unicuspid aortic valve. Quadricuspid aortic valves are rare, with an estimated prevalence of less than 0.01%, and the estimated prevalence of unicuspid aortic valve is around 0.02%. What's the etiology of aortic stenosis? There are three main etiological factors contributing towards the development of aortic stenosis. 1. Bicuspid aortic valve. 2. Rheumatic heart valve disease. And 3. Age-related degeneration of the valve. The commonest cause of aortic stenosis in the UK is age-related degeneration of the valve, which is characterized by progressive thickening, fibrosis, and calcification of the aortic cusps. Risk factors for calcific degenerative aortic stenosis include hypertension, dyslipidemia, smoking, diabetes, and impaired renal function. Now, what are the hemodynamic principles of aortic stenosis? The normal aortic valve is compliant and opens fully and presents almost no obstruction to blood flow out of the heart during systole. With worsening aortic stenosis, the valve becomes progressively more restricted, and consequently, aortic valve maximal velocity and mean gradient are correspondingly higher. Maximal aortic valve velocity, mean gradient, and the estimated aortic valve area using the continuity equation all assess the hemodynamic impact of the effective orifice area and as such are useful for the determination of prognosis. And what is the role of echocardiography in aortic stenosis? Echocardiography is central in the diagnosis, assessment, and management of individuals with aortic valve disease. In all patients with aortic valve disease, it is imperative that they undergo a complete and careful echocardiographic evaluation according to the principles of the minimum dataset. Now, what are the key points when performing an echocardiogram for the assessment of aortic stenosis? First, calcification is central to the development of aortic stenosis. Second, echo studies should describe the pattern and burden of calcification. Third, echo studies should identify thickening of cusp and restriction of motion. And fourth, in the absence of significant calcification, important aortic stenosis should not usually be considered. On the next video, I'm going to show you how to assess aortic stenosis with echocardiography. Thank you for watching. Don't forget to like this video and to subscribe to my channel. Bye!